You are my helper, oh.
Childbirth, as we know it, is always a thing of joy. Perhaps no other scenario can capture the human essence in terms of rejuvenation, hope for the future, and the beauty of life in itself. In Africa, as in other parts of the developing world, Nigeria inclusive, this joyous event has often been turned into indesirable grief at the loss of either the baby, its mother, and in many cases, both of them. Over the years, statistics have shown that the major reasons for these sort of deaths, known as maternal and child mortality, include the absence of professional caregivers or skilled birth attendants. To counter this ugly trend, the Nigerian government set up the Midwives Service Scheme (MSS) with a mandate to penetrate the rural areas where cases of maternal and infant mortality were prevalent. Today, this scheme is helping Nigeria actualize the Millennium Development Goals.
The scheme is born out of our desire to collectively reverse the appalling maternal and child health outcomes in Nigeria.
Based on the mandate they received from the government, the National Primary Healthcare Development Agency in Nigeria began to structure a workable pattern of recruiting and posting midwives to areas in dire need of their services.
The use of technology has also helped us to monitor the progress of the scheme, to know where midwives are posted, where they're staying, how much they are accomplishing in terms of seeing pregnant women, deliveries that they are able to supervise, but also tracking progress in other dimensions of the scheme. That has helped the program sort of develop into the largest of its kind in Africa. The Midwifery Service Scheme is the largest of such interventions in the whole continent of Africa. An intervention that is targeted at saving the lives of women, particularly rural women, because all our facilities are in the rural areas.
We have labor case there's a labor case, an emergency. And since you told us that you want to see, please, can you kindly rush down to UNFPA PSC? The woman is already, she's already 6 centimeters dilated.
What is, where
please rush to UNFPA PSC. Yes, ma'am. Yes. You are welcome, ma'am.
Today, the efforts of these midwives have saved countless lives, especially in the rural areas.
The infrastructure within the MSS scheme, linking the midwives to health facilities, facility, providing a backup referral system, linking them with ambulances so that they can actually have referral, equipping, but also providing basic commodities where the midwives are posted, I think has helped. The linked to community, the ward development committees basically has fostered ownership, so that these midwives are not coming out from somewhere else and just being plugged into facility, but they're really embedded within a community, because everywhere we send midwives, there's a ward development committee formed around the facility which owns this effort.
It will be only fair to admit that some gaps still exist.
We have about 4,000 midwives whom we have deployed to carefully identified primary healthcare facilities, 1,000 in number, in rural communities. And each of these midwives, we have deployed 4 midwives. Each of the PAC centers, we have deployed 4 midwives. These 4 midwives are deployed in this number so that we can ensure 24-hour service. Because globally, it is reported that the presence of midwives in 24 hours at the primary healthcare facilities or in the facilities nearest to the people is very important if we have to address issues of maternal mortality.
We don't have ambulance to transfer to quickly rush our patient to the nearby general hospital. We only write our referral letter and ask them to go to the general hospital for more proper management. That's what we do, because for now we don't have ambulance.
Majority of our MSS facility, there is no electricity and there is no standby generator. So in the night, Even if the midwives are on ground, people, they don't want to come and deliver because they will say there is no light. They prefer where there is electricity, so that even if anything is happening, the midwife will see everything, not that the midwife will be using torchlight or gas lamp to take delivery.
On the positive side, rural communities have been strengthened and sensitized to the level that they now exercise ownership and oversight of the MSS scheme by making sure that the midwives posted to their communities are safe and comfortable no matter their ethnicity.
You come closer to the community, you're able to know their problems and know where to come in and how to help them. And the women and the community entirely is very happy for one to belong to them. You know, they are very accessible.
To most of the rural area, since we have the manpower, I think the problem now lies on our hand. For us to move, to work well, we have the skill already that we have to work for the community to reduce the maternal and the child death.
Are you saddened that women are dying?
Yes, it's very saddening because immediately I heard the news that a woman died during childbearing. It's very painful. Because the only thing I don't know what to do, but I want it to be reduced drastically, maybe to 1% in our community.
The MSS program is very effective here, and the community, they even they are patronizing the clinic because of the establishment of the MSS program. Once they book here, they normally report when they are in labor.
Before we normally attend to only 10. Sometimes we even see 5 women on clinic. That's on antenatal days. But these days, because of the free antenatal and the MSS facility on ground, we normally record 30. We started from 20, 30, 50. From last week, we started attending to up to 50 to 73 women.
The truth is that in today's Nigeria, especially in the rural areas, childbirth is not as dangerous and uncertain as it once was. Today, pregnant women are more accepting of the modern methods that the MSS scheme has introduced in their communities.
This is a country where we don't have enough medical manpower to cater for, the services we are talking about. Like in Germany, yes, every delivery will be accompanied by a midwife and a doctor. But we have not reached that stage. We haven't reached it because we don't only have enough manpower. We haven't reached it because most of our health institutions are in the rural. And most of our colleagues will not want to go there because of lack of the necessary thing that gives life greenery. I like to be very funny in my description. Right, so you need these midwives who are like the first port of call. I mean, in the olden days, they are the first people that deliver, mothers. You need to train them, or the ones that are already trained and retired, they are not tired. This is the only country that I see people who are as elderly as I am being called pensioners. You are still strong, so we plow them back. It's a very wonderful scheme.
The age-long suspicion of anything Western is fast disappearing. It is constantly being replaced with the results that schemes like the MSS is showcasing.
Through an act of participatory learning and action approach. In participatory learning and action approach, we use some tools to identify the entry point of a community, identify the key players in the community, because they are very, very important.
The challenge may indeed be in the question of sustainability.
There are areas where we have not reported maternal death since the midwives have been posted. But one thing we are also able to do is to institute what we call the medical audit for maternal death. And what it does is for the midwives themselves to follow up to communities where maternal deaths have been reported to find out what were the immediate causes of death.
What we intend to do is to hand over to them at a time when they are able to take over. We're not just going to leave them with it like that. So as far as we're concerned, monies are made available as they exist now to scale it up to even more local governments. But in principle, there is a strategy that is conditional to states and local governments taking over. We're doing two things, because what you have to do is show somebody success, they will buy into it. It's the easiest commodity to sell. Nobody likes to buy failure or a challenge. So the two things that we're looking at is, first and foremost, not relying just on the midwives, but having the community health extension workers go out to the communities for preventive care. And you will see that we're going to support several thousand being deployed by the Primary Healthcare Development Agency.
If statistics gathered from the 652 MSS frontline facilities are anything to go by, Nigeria is on the right path towards eradicating unnecessary cases of maternal and infant mortality.
The true story is about the commitment of a few to realize a big win for our women, and the reduction in the maternal mortality is evidence to its success.
MSS has won international recognition. The message, therefore, is clear and simple. It is possible to save lives and keep our mothers alive and healthy.